as we go. We can try to get to them as we go, or we'll get to them at the end. But otherwise, yes, it is being recorded and will be uploaded to YouTube at a later date if you have to leave early or you would like to share it around. So please in the chat, do not type in any personal information, social security numbers, phone numbers, anything like that, addresses, all that good stuff. To keep it to general questions. And if you have more specific questions, we can definitely connect you with our intake line in the future. And with that, I will turn it over to our presenter for the day, Rachel Funk, one of our elder law staff attorneys. So take it away, Rachel. Thank you.
Oh, great. Thank you, Isaiah. I appreciate the intro. Yeah, I'm glad to be giving this presentation today. And do feel free to ask questions in the chat. Because I'm sharing my screen, I'm not able to see the chat, but Isaiah will interrupt me at any time with questions if you have them as we're going through. I've prepared the presentation to be somewhat short and kind of an overview with key points. So if you do have more questions about kind of the nitty-gritty, please feel free to ask them because we'll have a little extra time for questions. Okay. All right. So my name is Rachel Funk. So I'm a supervising attorney at the Legal Advocacy for Older People project at Southern Minnesota Regional Legal Services. Southern Minnesota Regional Legal Services is a free civil legal aid organization. We have been in existence now for more than 115 years. We began providing services in 1909. Our services are free and we cover 33 counties in southern Minnesota. So we go as far north as the Twin Cities in Ramsey, Dakota, and Washington County. And we basically go from there all the way to the southern border. So if you're looking at our logo here in the very top left, the area that is shaded in the lighter blue, that is our service area for SMERLs. The other area, the green area, there are different legal aid organizations that serve those areas, and there are a few also that are statewide. So legal aid programs, generally speaking, take cases that either don't generate fees or that private attorneys wouldn't take for other reasons. So we tend to focus on those areas that have to do with folks who are living in poverty. And I'll talk a little bit about our project and our intake criteria. But for folks who are not in our intake criteria, then SMERLS does have an income and asset guideline for being eligible for our services. We have a number of different practice areas at SMERLS, and that includes housing, economic justice, family, consumer, education, immigration, my project, the Legal Advocacy for Older People project, the Agricultural Workers project, and we also have a hotline. Each of those units handles a wide variety of case types. So our housing unit, for example, does a lot of landlord-tenant cases, but they are also they work on cases having to do with condemnation, um, property tax foreclosures, um, other types of housing issues that are not necessarily landlord tenants related. Our economic justice or public benefits program or practice area handles a lot of cases having to do with unemployment benefits, Social Security disability, SSI, SNAP benefits, emergency assistance for help with housing, and those types of programs. Our family law unit handles cases related to typically connected with domestic violence. So they can handle some custody matters, divorce matters, and things like that when there's a connection to domestic violence. Our consumer unit also handles a wide variety of cases, including some bankruptcy filings they're able to assist with, and issues related to consumer debt. We can often give advice about and sometimes assist with those issues as well. Our education law project helps students to have the services and education that they are entitled to in their schooling. Our immigration unit assists immigrants with a variety of different issues, And then my project, I'll talk a little bit about more. And our agricultural workers project handles cases related to agricultural workers in Minnesota. We also have a hotline at Smurls, which is staffed by licensed attorneys who can give brief advice over the phone, usually the same day that you're calling in for your intake, to help you have a plan for whatever your legal issue is. As I mentioned, most of the practice areas at Smurls do have an asset and um, uh, income limit for eligibility, but the Legal Advocacy for Older People's Project is funded under the Older Americans Act, a federal law, and that Older Americans Act law says that we are not permitted to do means testing. So for folks who are age 60 and over who are reaching out to us for help with a legal issue, we do not make a determination on eligibility based on that person's income or assets. Instead, what we do is we focus our work on legal issues that affect people in our population in the greatest social and economic need. So we decide about representation based on the case and not necessarily based on the person for those folks who are age 60 and over. Our particular unit often handles cases having to do with evictions. We also handle nursing home discharge cases frequently, assisted living contract terminations, which can be for services or housing or both. We also handle cases related to termination or reduction of waivered care services. So if you have CADI waiver, elderly waiver, and you're having a termination or reduction in services, that's the kind of case that we're often able to assist with. We also help with appeals of public benefit denials, reductions, or terminations. And then elder abuse and exploitation, we work on handling cases related to those issues as well. Fair housing, reasonable accommodations are a common issue that we help with. And then we also provide at least advice or referrals on other issues, unless there's some reason that we can't provide any kind of assistance, which is pretty rare. We generally can at least provide advice and referrals for the folks that are calling in for our help. We have a variety of different intake methods, so ways that you can reach out to Smurls to be evaluated for our services. The most efficient way probably still is telephone. I've got our 877 number here. It's 1-877-696-6529, or you can also spell it out as 1-877-MY-MN-LAW. That line is staffed from 9 a.m. to 3 p.m. And if you are calling outside of those hours, you would just leave a voicemail message and you'd get a call back from someone from our intake staff. We also do have intake available through our website. So I put the link here for you to reach out. You send a message through the website and then you get a call back from our intake staff during our intake hours. And intake is unavailable on weekends or holidays, but you can still look at lawhelpmn.org for fact sheets and other legal information if our intake is not open. As I mentioned earlier, our service area is in blue in our logo, but these intake methods are the same statewide. So all of the different legal aid, legal services organizations in Minnesota that provide civil legal representation, they all work together in a coordinated intake. So there's no wrong door. If you call this 877 number with a legal issue, you get automatically routed to the right legal services organization that serves your area. If for some reason you happen to complete an intake and speak with staff at any particular legal aid organization and they realize that actually your case should be looked at by a different organization, we are able to ask for your permission and then send your case over internally to that other legal aid organization. So we don't share information in the sense that we can't look at each other's cases, but if we have your permission, we are able to send over your contact information and what your legal issue is so that they can just seamlessly work on it from there. So there's really no wrong door. Wherever you are in the state, you can call this 877 number and be connected with the legal aid organization for your area. When you do an intake at Smurls, you should be prepared to provide an intake worker who's not an attorney some information so that they can open your case, do a conflict check, and make sure that you're eligible for our services. So you'll need to be able to give your name, your date of birth, your phone number, your address, and just a basic description of your legal problem just to help them understand where it should go. We may also ask you for your income and asset information, even though if you're age 16 over, we don't factor that into whether you're eligible for our services, but we may still ask you that information at intake because it could have an impact on the case that you're contacting us about. So, for example, if you have a medical assistance termination issue, based on financial eligibility, we will need to ask you what your income is to be able to determine whether that termination is correct or incorrect and what your options are related to it. So that's just important to know. We also employ people who speak Spanish, Somali, Hmong, Vietnamese, and other languages commonly spoken by our clients. If we do not have a staff member who's available who speaks the language that you prefer to communicate in, we use language line over the phone at no cost to the client. So we try to stay away from using family members or other friends to do interpreting for a number of reasons, but I think primarily because when you reach out to a legal services organization, when you're contacting them for legal advice, you have confidentiality with the staff at our office. So reaching out to a legal aid organization is a confidential communication. If there's somebody else involved in the call that can cause a problem for our confidentiality, and also, you may not want your family member learning your private business to help you with interpreting. So instead, we prefer to use language line, a neutral person who does not know you to do the interpreting. And that way, you don't have to worry about what you're sharing with somebody else in your life as you're reaching out for legal advice. And that also, I don't have a slide on this, but one thing that we often see in our cases is that, especially our senior citizen clients may call in with a support person on the line with them. And that's completely fine. If you need some help with calling into legal aid, that is fine. We will need to confirm that the client is on the line and that the client does want the other person to be on the line as well. So you can have as many people as you like participate in the call. But we, as a legal services provider, we need to know that the client is giving permission for those people to be talking with us. And we're not going to give permission, we're not going to give information to somebody who's calling about you without your permission to do that in some very limited circumstances, except for some very limited circumstances. Okay, so that's kind of the background on Smurls and how to reach us and what kind of services we provide. So next I'm going to move into the kind of meat of my presentation today about transitioning from PCA and CSG to the Community First Services and Supports, or CFSS program. And I'm sure that I will say that wrong a few times as we go through. CFSS is just sort of difficult for me to say, so bear with me on that. So I've broken it up into a few different areas. First is just background and overview of the terms involved, a timeline of the changes as this transition process happens. We are kind of in the middle of it, so a little bit of the timeline to expect going forward. Some key differences between the PCA and CSG and the CFSS programs, as well as some key similarities, because there are some similarities as well. We'll also talk about the steps that a recipient of PCA and CSG services needs to follow to do this transition, and what to do if there is a problem, and some areas that I think there might be problems as we go forward. So we'll go through that as well. And again, If you do have questions about some more specifics as I'm going through, please feel free to put them in the chat and Isaiah will interrupt me to ask them, and that's completely fine. Okay, so background on some terms. Just again, level setting, making sure we're all on the same page. So the PCA program is, oh my goodness, I'm sorry. I have to correct this. I borrowed this from another slide and I forgot to change the middle part of it. But the PCA program provides PCA hours to somebody so that they can have assistance in their home. And typically the PCA program is administered by agency staff. So the agency staff is in charge of hiring and kind of coordinating for you to have your PCA. The Consumer Support Grant Program, or CSG, is a different kind of in-home support program where you get a budget and then you get to determine how you want to spend that budget on your care. And the Community First Services and Supports is the program that is being established now to replace both PCA and CSG. And I'll talk more in more detail about the exactly what Community First Services and Supports is, but just sort of generally speaking, the CFSS program is going to be replacing the CSG and PCA programs. Okay. So, in terms of the timeline, there are three phases for implementing the transition from PCA and CSG to the CFSS program. Phase one is already over. It was a very long phase, but it was a phase during which the recipients of PCA and CSG did not need to take any action. So this was all kind of behind the scenes. The DHS, the county and tribal agencies, and the providers were all doing the work behind the scenes to establish the rules for the CFSS program, get the policies in place, complete trainings and testing, updating policies, completing paperwork, all so that the CFSS program services can be provided now in phase two. So individual PCA workers could complete the training to become CFSS providers during this period. And a lot of folks who went through PCA training and testing after April 15th of 2020 likely did get also certification in the CFSS. So if you are working with somebody who did their PCA training and testing after April 15th of 2020, their certificate should say whether they are certified for just PCA or if they have this, as I put here, PCA and CFSS support worker training certificate. So they should be able to look at that certificate to know if they've already done that training. CSG workers were required to complete the training and testing for CFSS during this phase one program. And the lead agencies and the financial management service providers were supposed to help with that enrollment. So if you're on the CSG program and your worker is not sure if they have completed the training to do the CFSS work, they should reach out to their agency if they have one. You can reach out to your financial management service provider for some assistance in how to get that CSG worker trained the way that they need to be so that they can provide services under CFSS. So that's phase one. That was kind of setting it up and getting people trained to be able to provide the services. And we are currently in phase two, which started in October 1st of 2024 and is projected to last, I believe they said 15 months. So projected to last until February of 2026. And this is the time period that recipients now must transition to the CFSS program at the time of their reassessment. And I'll talk again later on about exactly what those steps are. But that's where we are now. And then once phase two is over, then, anticipated to be February 2026 and beyond, the PCA and CSG programs will be ended and CFSS will be the program going forward. So at that point, everyone should have transitioned from PCA and CSG to CFSS and be established in that program. Okay. So the next area I'm going to talk about is what is CFS in more detail. So let's talk a little bit about that. There are two different models in the CFSS program. So these are both under the Community First Services and Supports, but they're two different models, two different ways of getting the service, basically. So there's the agency model and there's the budget model. The agency model is more similar to the old PCA program. So you get, if you've chosen the agency model, you get services in service units. So like hours, which you may, 5 hours a day, 7 hours a day, 2 hours a day, something like that. The provider agency is in charge of managing those units and putting those units where they're supposed to go. The agency employs the workers, not the recipient. There is a special budget for training workers, which is different from the PCA program. So there's money set aside specifically for training workers to work with you. Goods and services can be purchased under the agency model for CFSS. And there is a consultation service provider, and I'll talk more about what that service provider does as well. The budget model under CFSS is more like CSG. So you get a budget that you then determine how that gets spent on your care. So you have a financial management services provider that helps with managing the budget. You are the employer as the recipient. You are the employer of your workers. So you do the recruitment, you do the training for your workers. The budget model also does have special budget for training workers. Under the budget model, goods and services can be purchased just like in CSG, although the goods and services that can be purchased may be somewhat different under CFSS. And just like the agency model, there is a consultation service provider as well through the budget model. So the main differences between the agency model and the budget model really are whether you are getting your services in units controlled by the agency, or whether you're getting a budget that then you decide how that gets spent and you're in charge of hiring and training your workers. Eligibility for CFSS is the same as PCA and CSG. So the transition from PCA to CFSS, the transition from CSG to CFSS is it's not an eligibility change. That's not the goal of the change. That's not what it's designed to be. So just like with PCA and CSG as they are now, you need to be a Minnesota Healthcare Program enrollee. So that means, on MA, on a waiver, alternative care, or sometimes Minnesota Care can also get you into having the services through CSG or PCA and now CFSS. You need to live in your own home, which includes assisted living. So assisted living is not considered to be institutionalization for purposes of these programs. You need to be able to direct your own care or have a representative who directs your care. So what that means is that you need to be able to identify your own needs, instruct workers and evaluate their work, and recognize and manage your own safety or have a representative who does that for you. Um, and then you also need to have an assessed need for the CFSS services, which again is just the same as it is now. If you're applying for PCA or CSG, you have to do the assessment to make sure that you have an assessed need for those services. A CFSS worker, you have some more options than you had under the old PCA rules. So as of October of 2024, these rules were changed for the PCA program too. But back before that, there were a lot of restrictions on who could be your worker. And under the CFSS CFSS program, now your spouse can be your worker. If you are the parent of a minor child, the parent can be the paid worker for that minor child. And another recipient of CFSS services can also be a paid CFSS worker for a different person. And it really just depends on what the abilities are for that worker. So it's a recognition that just because you're receiving CFSS services doesn't mean that you can't also be a paid worker to help somebody else. What a CFSS worker has to be, though, is certified to provide the CFSS services. So, like I mentioned earlier, a lot of people who went through the PCA training and testing after April 15th of 2020 may already have certification for CFSS services, but they may not. And so it's important for your workers to look into their certification to see if they have certification for CFSS. And the CSG workers should have already gone through the training to be able to give the CFSS services, but you should have your workers confirm that they have done that so that they can provide CFSS services after the transition time period. Okay, so I mentioned in one of the earlier slides that under the CFSS program, either agency or budget model, you will have a consultation service provider. So this slide is kind of giving some information about what that provider is responsible to do. This is a pretty significant change. This is not something that existed or exists in the PCA or CSG program. Consultation service provider was not a role in those previous programs. So this is a new thing. The responsibilities of the CSP is to educate and train the recipient on the CFSS program and the two different models, the agency and the budget models, to help the person determine which model would work best for them, which model they want to use. The consultation service provider is also responsible to assist the recipient with writing their service delivery plan if the recipient wants that help. So it's not a requirement that the consultation service provider help you write your service delivery plan, but you can ask for their support in that. And they are required to review your service delivery plan. So even if you haven't gotten their help with it, they are responsible to review it to check for its completion, to make sure it's complete, that it meets the needs that are identified in your MinChoices assessment, and that only covered services are included. And that review takes place before your service delivery plan goes to the lead agency, the county or tribal agency or MCO, managed care organization, for final review and approval. I mentioned that under the CFSS program, goods and services can be purchased under either model. So the agency model or the budget model allows goods and services to be purchased. This is also a pretty significant change, at least from the PCA program, because the PCA program did not allow for those types of purchases. And now you can receive you'll be able to receive CFSS under the agency model where you have units and still also be able to convert some of those units to dollars to be able to pay for goods and services. To be eligible for payment under the CFSS program, the goods and services must be related to your disability or your assessed needs in your assessment. And they must either be aiding you, the recipient, with independence or replacing or reducing your reliance on assistance from a person. So that is the category that the goods and service have to meet for your CFSS units or budget to be able to be spent on those goods and services. Um, and just a little bit more kind of to explain how exactly it works. It's maybe a little bit more detail than you need. But basically, the hours on an agency model, your unit service units hours get converted to dollars just for that amount that you need for the goods and services. So it doesn't convert all of your units to dollars, it just converts the amount that you need for the eligible goods and services. And then your you would have a financial management service to have that dollar budget spent on the goods and services, and then the unit and hours would be provided to the direct care provider or the agency basically. So in that way, when you have CFSS with the agency model, you typically wouldn't have a financial management service provider. But if you are going to have goods and services that get paid for, then you will have a financial management service provider to help you with that expenditure, if that makes sense. Under the budget model, it's basically your budget just includes the goods and services. So a portion of the budget is assigned to those goods and services, and then the entire budget is released to the financial management service provider for payment toward both direct care and the goods and services. So that's not really any different than if you're using the budget model and you don't have goods and services. I think there are a couple of important things that I want to highlight about this goods and service purchasing. I am going to go back a slide. Um, the goods and services have to be related to the assessed needs. And that is from your annual assessment that you do, or if you have an assessment because of a change in needs, which means that when you do that annual assessment, when the assessor talks to you and goes through their whole list of questions and the questionnaire for all your different needs and what you're able to do on your own and what you need help with, it's important to really pay attention to those questions and really focus on giving a complete and thorough answer to those questions, because all of the services that you're going to get um, through CFSS have to relate back to what's in your assessment. So you want to make sure, one, that you're being very complete and thorough in answering the assessment questions. Two, that if you need someone else there with you for the assessment, that you have them there. So if you have a support person that can help you answer those questions more thoroughly, make sure that they're there for the assessment. And then three, it's very important with your assessment to review the written assessment once it's done. After you complete a MinChoices assessment, you receive a copy of the assessment. You want to review it very carefully and make sure that it's accurate, because as you're trying to work on your service delivery plan under CFSS, it's all going to need to relate back to what was in that assessment as your assessed need. Okay. Okay, so next I'm going to talk a little bit about the key differences and similarities between the programs from PCA and CSG and CFSS. So starting with CSG, there are a lot of similarities with CSG and CFSS. Primarily one of the biggest things that's the same is that it's a self-designed service plan. So you're in charge of creating your service plan, which then gets approved by the lead agency. Much again, CSG and CFSS are the same in that you get a budget for your services instead of service hours. As I talked about before, goods and services can be purchased, and I just have an asterisk there because at least in the materials that the DHS has put out, they have mentioned that you may not get the exact same goods and services under CFSS that you were getting under CSG. So it's possible that something you're receiving now might not be approved for CFSS, or you might have access to something different that in CFSS that you didn't have in CSG. Again, there's a similarity that a spouse and or parent of a minor can be a worker. And just like in CSG, under CFSS, the lead agency has to approve the service delivery plan. There are also some differences. So the CFSS program is paid for in Minnesota or will be paid for in Minnesota by both state and federal dollars. The CSG program was only paid for through the state. So CFSS does need to comply with both state and federal rules, which is, I think, why it took a long time for the policies to be created, probably. Consultation services review all service plans before they go to the lead agencies, as I mentioned before. Um, in most cases, the CFSS budget will be larger than the budget in CSG. And in the DHS materials that have been provided so far actually say that most folks in CSG will have double the budget in CFSS. I have there that goods and services may be different in the CFSS program than what was available in CSG. CFSS has, as I mentioned, a special budget for training the worker to work with the specific recipient. And I don't remember off the top of my head what that budget amount is, but that is separate from the services budget. So this is a budget that is just for training your worker to be able to provide your services to you in the best way possible for you. I think the goal there is to make the services as person-centered and as high quality as possible. Um, Another major difference between CSG and CFSS is that people who are on the alternative care program and waiver recipients can use CFSS, but were previously not permitted to use CSG. And people who are age 65 plus and enrolled in a managed care organization can also use CFSS. Previously, they were not allowed to use the CSG program. There are also similarities between the PCA and CFSS programs. So, similar, it's a person-centered service plan. A spouse and or parent of a minor can be a worker, which, as I mentioned earlier, before October of 2024, you couldn't do that. You could not do that on the PCA program. But now, as of October 2024, you can have a spouse or parent of a minor as a worker under the PCA program as well. Um, Similar to the PCA program in CFSS, you can choose the agency model where the lead agency recruits and trains your workers. And also, just like with PCA, the lead agency has to approve the service delivery plan. There are also some differences, again, with the PCA and CFSS agency model. So goods and services can be purchased under CFSS, as I mentioned before, which was not permitted under the PCA. A personal emergency service or PERS can also be purchased. So like the life alert style buttons that you can have, that's also an option under CFSS. That was not an option under the PCA. A CFSS recipient can be a CFSS provider for another person. That's a difference there with the PCA program. The consultation service provider also has to be, that's, as I mentioned before, that's a new thing under CFSS that was not part of the PCA. And then another kind of significant change is that under CFSS, there is no longer an LT rating. So the new ratings for folks who under PCA had the LT rating would be P, Q, or R, depending on what their assessment is. And the DHS materials say that that is likely also to result in more service hours. I think the LT rating was maybe 2 hours a day for the LT rating, and then the PQ and R, I think, is up to 5 service units a day, if I'm remembering those numbers right. But again, the materials are anticipating that there should be more service hours available under the CFSS program than was available under the PCA program. So those are kind of the big differences there. Okay, so next I'm going to go through the steps that a recipient must follow in phase 2, where we are now, to do the transition from PCA and CSG or CSG to CFSS going forward. So the first thing that the recipient needs to do is just complete your annual assessment as normal. So on PCA, on CSG now, you do the annual assessment every year. There might have been some COVID interruptions there, but otherwise, you're doing that annual assessment every year to make sure that you haven't had any changes to your services that are required, and just confirm that the services you need are the same as before, or if they're different, what they are now. The next step is for the recipient to select a consultation services provider. And I have a link in the last or second to last slide with a list of consultation services providers. If you're already a recipient of PCA or CSG services and you're going through your annual assessment, your annual renewal, you should have received a letter from the lead agency, so either the county or the tribal agency or your managed care organization, telling you that you need to select a consultation services provider and giving you a list of places that you could reach out to. So, if you have a big packet of information from your lead agency about your annual assessment and about your renewal, take a look at that, and that should have a list of the different consultation service providers that you can reach out to try to work with them. And you should be able to, you get to choose. A lot of the providers are statewide providers. So hopefully that means that you have your choice in which provider you want to work with. The consultation service provider then should help you choose between the agency model for CFSS, where the agency does more of the work for you, and the budget model for CFSS, where you have more of the control and the work. So the idea is that the consultation services provider should help you make that decision between which model you're going to work with. As I mentioned before, the consultation services provider then is supposed to help you write your service delivery plan, but they don't have to unless you want them to. So after you've chosen between agency model and budget model, you need to work on writing your service delivery plan. Then choose your provider agency for both models and your financial management services provider, if you're using the budget model, or if you're using the agency model, and you'll have goods and services included with that. So you need to do that as well. And then if you have the budget model, you'll need to recruit and train your workers. So it seems like a lot of steps, and to be honest, I think it is a lot of steps that you have to do to make this transition from PCA or CSG to CFSS. And unfortunately, I think that's just kind of the nature of change, is that you have to take a lot of steps to be able to complete that change. What I would recommend for anybody, even if you have not come up on your annual assessment yet, is maybe, you'll look at the slides here. You can look at the list of the consultation services providers and start reaching out to see who you might want to work with to help you with designing your service plan, and choosing between the agency model and the budget model. There are a lot of helpful presentations on the DHS website about this transition, with some information that can help you make that choice between the agency model and budget model. And I'll get to that in a later slide, where you can go for a little bit more help if you want to take a look at that before your annual assessment comes up. And then also, as I mentioned before, you want to be sure with that annual assessment, the Min Choices assessment, where you're talking about what you need and um, what your assistance needs are, that you are being really complete in your answers to that. So you want to think about, when you're answering these questions, what help do I get when I'm doing these activities? Let me say that specifically to the assessor, that this is the help that I get. And what are the things that I'm not able to do because I don't have the help for it that I need, and what kind of help could I use to be able to do those things for myself? Then the last thing too here is, if you have the budget model and if you want to work with your current workers, you should talk with them even before you have your annual assessment. You should talk with them to make sure that they have done the training and gotten the certification to provide the CFSS services. So you want to make sure that anybody that you want to keep working with after you've transitioned from what you have now to the CFSS program. You want to make sure that they are able to provide those services so you don't have to find somebody new if you're happy with who you're working with. Okay, so since it's a lot of steps, what if you need more time? What if you're working on it and you're you just need more time to be able to make this transition? The DHS has put out some guidance to lead agencies that the lead agencies should be authorizing additional months on the PCA or CSG program if you need more time to make that transition. So if you've done your assessment on or after October 1st of 2024, so once that phase two transition period started, and if your current service agreement will end in 2 months or less, and there's what they're referring to as a unique circumstance that means that you need more time to make the transition, then the agency should be extending your time by six additional months on the PCA or CSG program. I don't have a great explanation for what exactly unique circumstance is, but I think generally, I would guess that most folks who, have been trying to find either a financial management service or, they've been working on their service delivery plan, or, just haven't been able to get all of the details in place. I would expect that those folks will be able to get 6 additional months of the PCA CSG services. But keep in mind that ultimately the goal is for those programs to end. So what you don't want to do is kind of wait until the last minute, get a 6 month extension, and then wait until the last minute again, and potentially face an interruption in your services when these programs end. Okay, so what to do if there's a problem? As I mentioned before, eligibility should not be affected by the change from CSG to PCA. So the types of services that are being provided may be a little bit different, but typically they should be the same, and your eligibility for those services should not change because of the transition from PCA to CSG to CFSS. However, because your transition will happen when you're doing your annual reassessment, there's always the possibility that there may be a reduction or change in your eligibility, your service hours, or budget because of your reassessment. So, as I mentioned before, you want to be sure that you're carefully reviewing the assessment summary from your Min Choices assessment to make sure it's accurate. You want to make sure that you're carefully reviewing any letters that you get from the county, from the tribal agency, or your managed care organization, because you want to be sure that you know right away if they're saying that they're going to change something about your services because of your reassessment. And you want to pay attention to any appeal deadlines that you have. Any letter that you get from a lead agency notifying you of a change to your services should include information about your appeal rights, how to file an appeal, and when your deadline is to file the appeal. And I'm also going to talk about filing appeals here. But you should be able to look at your letter and find out exactly how and when to make an appeal if you need to. So although there isn't, just to kind of summarize the slide, although there's not a change to eligibility criteria from this transition, you may have a change in your actual service hours or budget or eligibility because of the reassessment that's done every year. Some potential issues, I think, with using the consultation service providers that may come up, and this is not something from the DHS, this is my own personal um, kind of assessment, basically, of what might be a problem. Um, so as I mentioned before, assistance from the consultation service provider with designing the plan is voluntary. It's up to you whether you want them to help you, but they are required to review your plan before submitting it to the lead agency for approval. So it may be a good idea to work with them during the drafting of the plan as well, so that you avoid, a surprise later on. Again, that is up to you though. If you're confident that you can write your plan in a way that isn't going to be flagged or otherwise a problem for the consultation service provider, then go ahead and do it and just submit it for their review. What do you do if you disagree with the consultation service provider on the design of your plan? So if they've reviewed your plan and they tell you, we don't think it's complete, we think it has things that aren't covered in it, or we don't think that it sufficiently connects with your assessed needs, what do you do? That's a very good question. The lead agency action is the action that you can appeal, not the CSP action. So my recommendation is, if you're having a lot of back and forth with your consultation service provider and they're telling you that they don't think that your service plan will be approved, um, but you don't think that you should have to make any changes to it, my recommendation would be to tell your consultation service provider that they need to just forward it to the lead agency for approval or denial so that you can have your appeal rights about it. And it may be that the lead agency agrees with the consultation service provider that your plan can't be approved. And in that case, you'd be able to appeal it and have a hearing in front of a DHS human services judge about whether your plan can be approved or should be approved. That would be my recommendation in that particular circumstance. And then if you have had a problem working with your consultation service provider, if you think that you want to change to a different one, then you can also look into changing that over, making that change from who you have now to a new consultation service provider. Um, As I mentioned, you do have the right to appeal an agency action. So that includes a denial. So that would be like a denial, in this situation, a denial of your plan that you've written, or a reduction of approved services. You can also appeal. There are other things that you could appeal I've listed here, but the ones that apply for this potential transition issues would be a reduction of services or a denial of your plan. You should file your appeal typically within 30 days of your notice. If you want to continue receiving continued benefits, you should appeal within 10 days of your notice typically. But you can file an appeal up to 90 days with good cause. So if you've missed that deadline for appeal, you can still appeal it if you have good cause. And good cause means that either a personal injury or illness interfered with your ability to appeal, or another emergency or other obligation which reasonably took precedence over appealing, or excusable neglect. So some examples would be, if you didn't get the letter in the mail until too late, then that would be good cause typically. If you had a hospitalization and you weren't able to file your appeal while you're in the hospital, those are all reasons that you may be able to file your appeal after the 30-day deadline and still have it be processed. Best practices, of course, are to file an appeal as soon as you can if you think you need to. So within that 10 days to get your continued benefits pending appeal, or within 30 days of the notice. And sometimes what we see is that folks will, instead of appealing, they will file a new application for medical assistance benefits that they're expecting to have retroactive eligibility. My advice is always to appeal instead of doing a new application. When you do a new application, you're starting your time clock again, you're having to submit all new information again. Um, I think it's just worth it to do the appeal instead, unless you think for some reason that the whatever the adverse action was from the agency is correct, but now you have eligibility going forward, then I would recommend doing a new application. If you're trying to decide between the two, you can always reach out to our office and we can give advice about whether we think an appeal or a new application is the right move for you. To file an appeal, you can do it online, and that's the way that I would recommend because it is very quick and easy. You can go to the Department of Human Services website, go to the How Do I Find an eDocs and Forms, and then search for the form 0033. And that is the form that you would complete to submit your appeal. You just do it online, and it goes into the DHS system that way. You can also complete a paper form and mail it in to the Department of Human Services Appeal Office. I put their address here, or you can fax it to their office as well. And again, any letter that you get from the lead agency, your county or tribal agency, should include information about how to file the appeal, where to send it to, and what information you would need to include. At a minimum, you should include the date that you're writing your appeal, your name, your medical assistant's case number, and a very brief description of the reason for appeal, which could be something as simple as I used to get 6 hours a week of PCA hours, and I'm getting 2, and I don't think that's right. It doesn't have to be anything fancy, it just has to kind of generally state what it is that you're disagreeing with from the agency action. If you have a managed care organization that manages your services for you, then typically you are required to do an internal appeal to that managed care organization before you can do an appeal to the Department of Human Services. So again, the letter that you get from your managed care organization should include information about how to do that internal appeal, including where to send it to, when you need to send it by. And then once you have completed your appeal internally to the managed care organization, they should issue you a written decision after they've reviewed your appeal, letting you know whether they're going to uphold the initial decision or change it based on your appeal. And once you've gotten that written decision, that's usually when you're able to appeal to the Department of Human Services to have a hearing with a human services judge about it. It is very important to follow these steps. I have had cases where if clients have skipped that internal managed care organization appeal and the DHS has dismissed the appeal to the DHS because they said they don't have jurisdiction if it hasn't been appealed to the MCO first. So you do want to follow those processes carefully. And again, if you get a letter from your managed care organization that's making a change to your services, you can call our office and we can at least give you advice over the phone if we're not able to represent you on that issue. So here in the last 2 minutes, I've got, and we will send out this slide deck so you have these links. But as I mentioned, the DHS does have a list published of consultation service providers that provide services statewide, and I put the link there. And there are a lot of really helpful short videos on the DHS website to learn more about CFSS. And in particular, the link that I put here includes a questionnaire that helps you choose between the agency model and budget model. And it also includes a calculator that helps estimate what your budget might be. So what your hours might be on the CFSS model and what your budget might be if you choose the budget model. So I found that to be a pretty helpful video kind of interactive presentation that the DHS had. So I put that there as well. And with that, that is the end of my presentation I had prepared for today. We do have just a minute or two left, so if anybody has questions that they want to put in the chat, for some more general information, please feel free. And otherwise, you can call our intake number here on the screen if you have questions that are more particular to your situation that you're looking for legal advice on.
Awesome, awesome. Thank you so much, Rachel. Yeah, we did get more so an experience than a question. Yeah, a few minutes ago here, someone said the LT rating that they received was 30 minutes a day for 2 units,
Okay.
and we're getting a
Yep.
thank you.
Yeah, right. And I think what the DHS materials say are that with ending the LT rating and switching now with CFSS, the PQ and R ratings, I think they've said that there is supposed to be an increase to hours with that change.